welcome everyone to I want to welcome everyone to this week's Independence Amplified Maryland, put on by the Maryland Centers for Independent Living. I'm Katie Collins-Zerke. I'm the Executive Director at Accessible Resources for Independence. We serve Howard and Anne Arundel counties. I'm joined today with Sarah Basehart from Independence Now, who serves Montgomery and Prince George's County. We had applied for a grant through the Maryland Department of Disabilities in partnership with the Maryland Department of Health to focus in on chronic health kinds of preventative measures. And so both of our centers applied for these funds, and we were able to get some funding to pay for, ARI is going to be paying for a curriculum about living well with a disability, as well as some exercise classes. And Sarah applied for, what did you apply for?
For dollars that helped us buy adaptive, either fitness equipment or cooking equipment to allow. And don't forget that Amber Woods is on and has invited folks to join us.
And then there's Amber Woods. And Amber, your organization was funded as well?
Oh, absolutely. With the National Federation of the Blind National Harbor chapter in Prince George's County and also Charles County. What we've done is that we had more focus on the diabetes, but we also did chronic conditions as well. And we got adaptive material that was an MP3 player for the diabetic wellness kits that the wellness kits program normally comes with. But we made sure that it was accessible to the blind because what we noticed is that there's a lot of barriers when it comes to materials, when it comes to these classes in the blind community. That's what our grant was more focused on. So what we made sure is that we got the wellness book that comes with it, the relaxation tape, and also the exercise. Well, I'm saying tape, I meant to say MP3s or MP4, whatever is more, compatible for the participants. And the I think I said the relaxation MP3s as well. So MP4.
Great. Thank you. So just to kind of give you an outline of today, one of the things that we've been tasked with as awardees of this grant is to identify barriers to people accessing public health programs, including chronic disease prevention programs or chronic disease self-management programs. And so we're going to have a discussion about barriers to that. But first, we thought it would be helpful to learn about chronic disease self-management programs and some of the other things that are going on at the Maryland Living Well Center of Excellence. So we brought on Wendy Farthing from there, and I'm going to let her introduce herself and talk a little bit about her program. So Wendy, take it away.
All right, I'm going to share my screen in a second. Can everyone see that? Okay, great. Well, good afternoon, everyone. Thank you for having me. My name is Wendy Farthing, and I work with the Maryland Living Well Center of Excellence. I serve as the Director of Chronic Disease Self-Management Education and Falls Integration for the center. The center is a division of MAC Incorporated, which stands for Maintaining Active Citizens. MAC is actually one of the oldest area agencies on aging in the nation and is located in Salisbury, Maryland. And we serve as a hub for the state of Maryland for a variety of evidence-based programs. So back in 2015, the Maryland Department on Aging designated MAC to expand the delivery of a variety of evidence-based programs across the state. They typically work with area agencies on aging, but MAC was then working with health departments and hospital systems and physicians' practices. So through the Center of Excellence, we hold statewide licenses and work with a variety of agencies. And we oversee training, technical assistance, the licensing for the programs, fidelity monitoring of a variety of evidence-based programs across the state. And again, we work with a variety of partners through contracts and collaborations. So we work with a variety of nonprofits, over 30 different hospital systems, Maryland primary care providers. We work with CRISP, which is our local health information exchange, a variety of health departments, and we'll talk a little bit more about the programs today, our partnerships with Maryland Department on Aging and the Maryland Department of Health, and how your agencies can have availability to either attend workshops or become leaders and embed that within your agencies for the delivery of chronic disease programs. So again, some of the programs that we offer across the state, if you're familiar with Stanford University, they were the developers of chronic disease self-management education. They now have their own agency, Self-Management Resource Center out in California, and they have a suite of programs, including chronic disease, diabetes, chronic pain, cancer thriving and surviving, and building better caregivers. They are offered in a variety of languages around the world. We have the ability across the state now with different partner agencies to offer them in English, Spanish, Korean, and Chinese programs. We also offer PEARLS, which is an acronym. It's a Depression Intervention Program. PEARLS stands for Program to Encourage Active and Rewarding Lives, and that is for older adults who are dealing with depression. We offer a variety of evidence-based falls prevention programs, including Stepping On, Tai Chi Quan, Moving for Better Balance, and Enhanced Fitness. And the work that between the Center of Excellence and its various partner agencies since 2015, we have reached over 12,800 people with these evidence-based programs across the state. The delivery, for the most part, has been done in in-person workshops, and with COVID, clearly the developers had to revamp, and we have been able to do virtual offerings for most of the programs now across the state, and have worked with the Maryland Department on Aging and a technology partner to develop lending libraries across the state with different agencies so that program implementation can happen to folks that have been socially isolated at home and don't have technology to take the classes. So again, this is the next slide is a slide of a variety of the logos of the programs that I just mentioned. And I will talk briefly a little bit about these programs in a few slides down. We have been fortunate to be recipients of a variety of administration of community living grants since 2015. That is federal grant funding that has been awarded to the state of Maryland through the Maryland Living Well Center of Excellence, originally for chronic disease self-management education and for falls programs. That was for building capacity, and then received additional grants in chronic disease self-management education and falls prevention programs for building sustainability. And since COVID, now we're back really to building capacity across the state. Recently, this past September, we were awarded a network lead entity grant for ACL. And that goal is to standardize social determinants of health screenings across the aging network, which would include nonprofit community organizations, hospitals, primary care providers, and really align those services for referrals and reimbursements through that total cost of care model. And with MDOA, we are trying to develop integrated statewide systems to support that access to and the sustainability then for billing Medicare and promote that continuum of care between the clinical and community providers to address social and health needs. So it's going to take a lot of partners from a nonprofit side, the work with Chris that we'll be doing to identify patients and have that referral network, and then really aligning systems so that folks can be put through to a variety of programs and wraparound service, and then have the bi-directional data share on them so that that information then can go back to a primary care provider and have clear communication about a patient. So through this NLE grant, we are looking to integrate a statewide system that would be able to support access, sustainability, and participation in evidence-based behavior change programs. So the various SMRC programs that we work with, PEARLS, we're also going to be bringing in Home Meds, which is a medication reconciliation program, which involves a pharmacist and going through meds that, when folks are prescribed from a variety of providers, so that people are safe and there's an opportunity to keep them safe and well and healthy longer in their homes. We'll also be implementing a standard screening for social determinants of health needs across community-based organizations and providers, so that social determinants of health screeners are often in siloed systems, with providers addressing medical needs and community-based organizations addressing the social and the functional and the environmental needs. So we really are trying to align those so that we're all singing the same song off the same page. Establish a multicultural aging network and create a reimbursement learning collaborative for area agencies on aging and community-based organization. So from this grant, the Center of Excellence then is the hub for the state, but would be the opportunity for a variety of partners across the state, community-based organizations, to participate in a learning collaborative for this aging network, and have an opportunity to have their needs and opinions and work on that sustainability piece for the state. So there's an opportunity for your agency to participate in that from a nonprofit standpoint. So happy to address that after this presentation or the call if you are interested in participating with that. To work with Maryland Hospitals, Maryland Primary Care Program, and CRISP to document a return on investment and improved quality of life for older adults and folks with disabilities. And then to leverage existing contracts to pilot reimbursement models that will lead to sustainable funding streams. We all recognize that, grants are getting fewer and farther between, and, it's not sustainable to be grant funded all the time. So we really want these programs not to disappear after a grant goes away. So how do we work, and how do we work with billables so that there is sustainability in the programs? So the Maryland Department on Aging and the Center of Excellence, we work closely together to expand access to the internet for Maryland's older adults. We have worked on a project with them with some loaner 5G tablets, and some tablets have been provided across the state for low-income seniors statewide. We are working to align priorities so that their state goals for aging align with their 5-year state plan, including leading the way to change a landscape of recognizing the needs of older adults and respecting the power of community partnerships within this healthcare system. We have multiple contracts with the Maryland Department on Aging. This is through the Center of Excellence across MAP, which is Maryland Access Point, which I'm sure you all are familiar with, their nutrition programs and their caregiver services. And then Cameron Pollock, if you know that name, he and I both co-facilitate the Maryland Falls Coalition. And we also meet weekly with area agencies on aging to support their implementation of Title III funding programs, which is all the health promotion programs. If you want to make note, our Center of Excellence, we have developed a Living Well website, which is a work that is constantly being revamped, renewed, and we want your feedback. So I'm going to navigate us through that in a few minutes, just so that you can see where these programs are housed. There's training opportunities. It's a website with a variety of resources, marketing materials, tools for coordinators that run our programs across the state, for healthcare providers, for leaders that are trained in our programs, as well as for participants who want to attend the programs. We've housed the MDH calendar for evidence-based programs on the site, and it is they are tied in with the variety of different program offerings that we offer.
Pardon me, what is this? Hi, my name is GLK.
I'm sorry.
Hi, Chioke. We're learning about the Living Well Center of Excellence. We'll be taking questions in a few minutes, okay?
So we have the ability at the Center of Excellence to do screenings for social determinants of health and make referrals to appropriate services and evidence-based programs. We have the ability to do collection of individual and population health outcomes. So based on our partners' needs, what they need to be collected, we want to make sure that additional grants are awarded and that we're constantly bringing in a variety of evidence-based programs that support the community. And with the work with CRISP, which is the Health Information Exchange in Maryland, we have the ability of tracking both pre and post clinical measures. So that's really important work, especially with this Network Lead grant, when you can identify a participant and know that maybe their encounters in the hospital have been less frequent after taking an evidence-based program, or less expensive to a provider, that the programs are working, and we can show that with pre and post clinical measures when we work with CRISP. So again, the Center of Excellence website, we have the ability with our partners to do registration referral into the programs, and all the different classes are linked in the calendar on our website. We can offer quarterly reports on patient activation, so we can tell and be able to communicate with a provider. Say someone wanted to take a chronic disease class, and maybe they attended 2 of the classes and then dropped out. We would be able to communicate that information with the provider so that they can have that conversation with their participant. We also offer satisfaction engagement and quality assurance monitoring. So we're constantly, when we do train, we want to make sure that our leaders feel competent and capable in delivery of the material, but they're following the fidelity of the workshops, how important that is, because evidence-based programs, if you're not familiar with that terminology, they have been researched nationally, and based on you implementing in the way that they're supposed to be implemented and not deviating from that, you have predictable results when you take a workshop, that they should match the results of the original finding in the studies. Maryland, if you're familiar with payer models, Maryland's very different than other states, and we are expanding an all-payer model to the total cost of care for all Medicare beneficiaries. So it's built on the state's inpatient all-payer model, which really sets a per capita limit on medical Medicare costs, total care in Maryland. By following this model, it is projected to save Medicare over $1 billion by the end of 2023. And this model creates new opportunities for non-hospital healthcare providers really to participate in this, to limit Medicare spending across the entire state. And this next slide is population health management focus, and it shows the impact of different factors on the risk of premature death. And if we look at this slide, individual behavior accounts for 40% of the different factors on risk of premature death. Social and environmental factors account for 20%. Healthcare accounts for 10%, and genetics counts for 30%. These evidence-based programs that we're talking about, whether they be chronic disease self-management or diabetes self-management, the various programs, they work because they address symptom cycles. And a symptom cycle could mean that, if I have a chronic condition and I have stress and anxiety can, make me have tense muscles or give me pain, or I might have fatigue because of my stress and anxiety. I might have shortness of breath. I might be having depression or other difficult emotions, worry, fear, frustration, all those difficult emotions. They all feed off of each other. So what happens in these evidence-based programs, it helps folks break the symptom cycle. They share resources and give opportunity for having toolboxes for an individual with chronic conditions. So it might be a tool would be mindfulness, breathing exercises, distraction, might be exercise or a healthy diet. Not everything about a person's chronic condition is related always to that chronic condition. Sometimes what we do in our environment attributes to some of the symptoms that we might be feeling. So that's the various programs help folks identify and develop strategies to implement tools that help break their symptom cycles. So if I look at a variety of evidence-based program, the next two slides, I did a breakdown of the different programs, like what the program is about, a description of them, and then who the target audience would be. And Katie, how would you like me to navigate this? Should I read all of these out? Or
I think if you just give a brief description of each of them, that would be helpful.
Sure. Okay. So chronic disease self-management education, it really targets to improve self-management skills and self-efficacy. And you're going to find that similar thread through the diabetes program, through chronic pain, cancer thriving and surviving, and building better caregivers. So it includes includes action planning, problem solving, decision making. They talk about nutrition, exercises, whether that's be for strength, flexibility, or endurance, communication skills, not just with your family and your friends, but your healthcare providers, your work, jobs, the appropriate use of medications, and then different techniques to deal with pain, fatigue, frustration, and work on goal setting. And I will have to say, with all of the SMRC programs, action plans are really important. You make them weekly. Communication skills, those core decision-making, problem solve, action plans, physical activity are threaded out through each of those programs. So the diabetes is really targeted for folks with type 2 diabetes. But on top of the chronic disease program, they also talk about monitoring healthy eating, preventing low blood sugar, delaying complications, strategies for sick days, etc. Chronic pain is very similar to the chronic disease self-management program, but includes activities as pacing, balancing activity and rest, and moving easy, which is a gentle, easy exercise program. So that's for folks that have chronic pain. We have folks across the state that might have a variety of chronic conditions. They might take a chronic disease program and then decide to take a chronic pain program, or take a diabetes program and recognize if they have chronic pain with their diabetes, and will take a chronic pain program, or they'll take a diabetes program a second time. Maybe they were signed up, with a loved one, and really, felt like they would get another more out of it if they took it again. So we don't discourage or don't allow folks to take programs more than once. Cancer Thriving and Surviving is targeted for adults with or who are in remission from cancer. Again, it's very similar through the chronic disease program, but it also talks about fatigue management, getting help, regaining fitness after cancer treatment, managing pain, dealing with uncertainty, future plans in healthcare, how cancer changes your body, making decisions about treatment or other complementary therapies, how cancer affects our relationships, dealing with depression, etc. There are two caregiving programs that we offer. One is Building Better Caregivers, and the other one is Powerful Tools for Caregivers. So Building Better Caregivers is for family caregivers with people that have suffered traumatic brain injury, post-traumatic stress disorder, dementia such as Alzheimer's, or any other conditions that can affect memory. Is
Parkinson's disease on there too? Parkinson's disease?
Parkinson's disease, yes, we have a variety of different chronic conditions. That's not exclusive to those conditions, but yes, someone with Parkinson's would absolutely be able to attend either of those programs. The Powerful Tools classes, the target audience is family caregivers of adults with chronic conditions. And it's really targeted for folks, the caregivers of individuals that have the chronic condition. It's used to provide them self-care tools to reduce stress, to help them manage their emotions, to increase their confidence in coping with caregiving demands. It also, the Powerful Tools for Caregivers has expanded their program to include parents of children with special needs as well. I mentioned Pearls earlier in earlier in the slide deck. Pearls is a depression program for adults 60 and up who have minor depression or dysthymia, and who are receiving home-based social services from community service or agencies. So as a behavioral health program, it's really a winner, because if you're, have any engagement with behavioral health programs now, it's very difficult to get not just referrals, but an actual appointment. So this one is led by peer leaders, and it reduces the symptoms of depression and improve health-related quality in life in older adults that are age 60 and up. There are 8 50-minute sessions. It's done either in person or virtually. They work on approaches for problem solving and action planning to increase their physical, social, as well as pleasant activities. So a patient would provide a variety of problems that they want us to work on over, it lasts up to 6 months. So it meets weekly first for 50 minutes once a week, then it goes bi-weekly, and then monthly. So the 8 sessions, it's over 19 weeks. And it gives the clients an opportunity to practice and learn different skills. Let me go to the next slide. Then we fall into the variety of falls prevention programs, from Stepping On to Enhanced Fitness, Otago, Tai Chi Quan, Moving for Better Balance. Stepping On is for community residing, cognitively intact older adults who are at a risk of falling, or who have a fear of falling, or who have fallen 1 or more times in the year. It's a 7-week workshop. There's a variety of guest experts that come in to deliver some of the material. They work on balance and strength building exercises. Talk about home safety checks, a review of medication that increases the risk of falls, the proper use of a walker or cane, strategies that can help prevent falls, how to get up, and visual impairment and falls, how that plays a part. So we have a vision expert that would come in. We have a pharmacist that would come in. We have a PT that would be there for 3 different classes. So it's a very interactive workshop for older adults. Enhanced Fitness is for older adults, from the frail to the fit. And this can be a class that can be taken seated or standing. And the instructors are trained how to modify exercises to suit a variety of abilities of participants. They meet 1 hour, 2 to 3 times a week for 12 weeks. There are many clients that will take Enhanced Fitness over and over and over again. And that's, they stay safe and well, and keep their fitness up by taking that class in a lot of the centers. Otago is for community dwelling frail older adults. It's most effective for those who are age 80 and over, or 65 and older and frail. It can be done in a home, an outpatient, or assisted living facilities, as well as in the community. It's 5 to 6 visits delivered over 8 weeks. They do standard balance and strength exercises in that program. And it's the program is initially, the initial evaluation prescription is done by a licensed PT. Let's see, Tai Chi Quan, Moving for Better Balance. This program has had a huge uptick over the last year. I think with COVID, we have trained a number of different agencies across the state, because we can do this one virtually as well. It is for community dwelling older adults who have had a history of falls, balance disorders, leg muscle weakness, abnormal gait, or walking difficulty. And it's delivered in 1 and 2 1-hour sessions for 24 weeks. And the goal of that is to improve strength, balance, and mobility, and prevent falls in older adults. We also have a variety of not evidence-based programs, but evidence-influenced programs. Oops, and this is, I zoomed ahead, sorry. These I call tickler programs. They often run in front of an evidence-based program. When we're working with older adults, not everybody's ready to take a 6-week workshop like that. That might be scary to them. So these are like snippets of a program. So we have Stepping Up Your Nutrition. We call it a session 0. It's an hour-long program. It's a single session malnutrition awareness workshop for community dwelling older adults. We utilize it before like a chronic disease program, or a diabetes program, or a falls prevention program. Participants in the class understand how Nutrition status and muscle strength are linked to falls risks. And then they learn how both exercise and protein are key to maintaining strong muscles. And they also recognize the importance of protein and fluids in older adult nutrition, and how much they need daily to stay healthy and well. And identify personal nutrition risk status, and then they set goals for behavior change to improve their muscle health and their nutritional status. Then we have living healthy with high blood pressure. That's a single session. It too is an evidence influence workshop. It's how to manage hypertension. So skill building include action plan, problem solving. What is high blood pressure? The problems with salt and sodium intake, home monitoring of your blood pressure, label reading, and then knowing your numbers. And then lastly, another session 0 is our dementia session 0. We have partnered with the Maryland Department on Aging, the Mental Health Association, and the Center of Excellence. We have a grant this is paired with either building better caregivers or our powerful tools for caregivers. This is a dementia session 0. It's an evidence influence workshop that it gives an overview of cognition and executive function, identifying signs of cognitive concerns versus what normal aging is, what dementia and the 4 most common types are, and the 10 warning signs. And then it also gives caregiver strategies in caring for a person with dementia. So it provides a ton of community resources, and then it kind of gives an introduction then into the caregiver programs. So I'm going to navigate us over to my website, and then please tell me if you can see. Can you see my website?
We can see it.
Okay.
Yeah, can you put it back up so I can get the
Yeah, it's mdlivingwell.org. And we just recently now are associated with Facebook. So if you like us or you have things that you'd like to share within the community, you can tag us and we will help expand your reach and help you push your activities that you're doing at your agency. So I encourage you to like and share us. So all these different programs that I just told you about, this is our homepage. If I click on programs, it talks about all the different evidence-based programs. There's commercials here for chronic disease self-management programs that you can download and use if you do want to offer it. It gives a brief overview of all the different programs that I just talked about. So for example, if I click on diabetes self-management program, it will take me down and tell me what topics are covered, what this workshop is all about, what I can expect from this class, who can attend, does the program replace existing programs and treatments, details about the programs, some feedback from a variety of participants that have taken the workshops. And then with each of the pages on the workshop, I have this link to our state calendar for the Be Healthy Maryland Department of Health. It's a little bit clunky, but it's all here. So if I want to say, I want to take a diabetes self-management program, this will show me a variety of classes around the state of when they're being held. So for example, there's a class in Elkton starts on January 4th at noon. There's one that just started November the 29th in Cecil County Health Department. There's classes in January at Frederick Health, Calvert County Health. Now, if I clicked on the details of this, it would give me information of like who I can contact to take that class. And if they are done in person, or if they're done in a virtual environment, it really doesn't matter where I live. I could live in Garrett County, and if something worked out with me with my time frame that I wanted to take a class in Salisbury, I don't have to drive to Salisbury to take a virtual class. So you're not limited by your geographic area in a virtual environment. So I'm going to go back home, turn to the programs page. So again, that will happen with any class that I click on here. It'll take me to the place on the website and then a calendar of the different classes. I was asked about trainings and opportunities for becoming leaders. So my first suggestion to anyone that is interested in evidence-based programs is to definitely take an evidence-based program. They are free around the state. They have great leaders across the state of Maryland. You would be sent your textbook or any materials for the class. If you would then like the class and you say, hey, I would like to lead a workshop like this, there's opportunities to become leaders. And that is here right on our website, training leader opportunities. So right now we are offering training to become leaders in chronic disease self-management education. We're starting our training January the 3rd. There is a cost to this particular training, but there are other trainings that we offer that are grant funded and have no charge to them. We also, from the Center of Excellence, are working across the state to build up capacity again and help some of our partner agencies who want us to lead workshops with them or on their behalf. So, and if any of you are interested in becoming a leader for the Center of Excellence, we are also working to expand our contractual leadership base across the state. So here on this leadership page, if you get trained in a training program, you would have like some paperwork that would say I would lead like 2 workshops a year, and then we have opportunity to earn, to pay out partners that would want to teach these workshops for other agencies. So that's right here on to work with our team. There are leadership opportunities for qualified candidates to implement evidence-based programs across the state of Maryland, either virtually or in person. From what I'm hearing and seeing through our coordinators across the state, pretty much 90%, if not more now, is in a virtual environment. We are building a leadership pool to assist partner organizations, and we would contact you back if that would be of interest to anyone. So I encourage you to take a look at the website. If you do want to work with us, we have a page for coordinators that all of the materials that you would need to implement workshops, you're given in trainings, and then there's support materials that are housed on this website. There are slide decks for the curriculum that is presented for the variety of programs that are offered. We offer support to our partner organizations as well. We have master trainers that are embedded across the state to provide support and help with fidelity of the programs. There's also public resources here that is available for you to view. We have COVID-19 resources, falls prevention, nutrition resources, diabetes resources, etc., that are all here, and information that you can view and download if you want. I think I covered my website pretty thoroughly. I don't want to, we'll leave some time for questions.
So Wendy, there's a question in the chat. It says, hi, these programs seem to be geared towards older or aging adults. Can you recommend any chronic disease self-management program geared towards younger adults? Thank you. Actually,
these programs, again, I work for an aging network, but these programs are available to anyone on chronic disease, diabetes, chronic pain, 18 and up, that have those chronic conditions. Now, the depression one is definitely geared for an older adult, the PEARLS, and the falls prevention one. But there are other, there are falls prevention programs that you don't have to be older to take them. And we do have plenty of folks that do across the state.
Great. Does anyone have any other questions before we get into the open forum session about barriers to accessing programs like this?
Yes. Do you also work with blind and deaf people too?
I don't directly. We have programs like these programs. I know we have offered, or the agencies that take these programs on and offer, they will have like sign interpreters come in to assist the folks, or some of the materials have the developer of the program has materials for like larger print, or it like we were discussing prior to this call, audio books, etc., that can be used as tools.
And also with people with what is it, cerebral palsy, like children with cerebral palsy?
Yes, they definitely attend.
Yes, thank you.
Thanks, Chioki. Any other questions while we have Wendy here?
I have one. This is Jennifer. Thanks, Wendy. That was really helpful. I know that people can sign up and search for classes through the Department of Health's Be Healthy Maryland, but how do other people, other than being at this forum and hearing about it now, how can they maybe get referred or learn about the program from any other community members other than, say, a AAA or an area agency on aging?
Well, like I mentioned, our partners now have been growing across the state. We work with 30 different hospital systems across Maryland. So a lot of them are embedded then within their agency, like MedStar offers these programs. Holy Cross offers these programs. Howard County General, a variety of hospitals offer these programs, so they're aware of them, as well as different health departments. They're running them, or they're making referrals now to them. And we've been educating primary care physician providers about them. And I think the conversation with the network lead entity grant is really going to be the game changer, is when that whole like crisp referral is going to be playing a much larger role than ever before into this. This will be a game changer for the state.
Great, thank you.
Did that answer your question?
It did, thanks.
Do you also work with people with mental illness too?
Yes.
Like with drugs and alcohol too? Or
We've done programs in a variety of settings, and to a variety of folks suffering from all kinds of chronic illness.
All right, other questions?
I just want to say, my name is Mary Morley, and I work in the Frederick office of the Freedom Center. And I just wanted to say thank you. That was a very good demonstration and whole thing you did. And I actually am going to find benefit, I think, getting and checking out your website. I think I may end up signing up for some of those classes. So I think it's a real good benefit for everybody.
I definitely encourage I mean, they're free and they can change your life, honestly. I mean, we've had so many of our leaders that teach for us across the state embedded within agencies is because they took the class. It was so rewarding to them that they wanted to come back and become leaders. So that says a lot about the programs, I think.
All right, great. Thank you, Wendy. We so appreciate you taking the time out. Feel free to stay or leave. We're going to kind of talk about barriers to accessing public health programs, including Living Well, you know, the different Living Well programs, as well as the other programs you have at the Living Well Center of Excellence.
I would like to hear your feedback, because I mean, I take this back to the program developers. Like this would be important to me. So
wonderful. Welcome to stay on. So I'm going to kind of just ask a couple targeted questions in the time that we have remaining. First of all, how many of you, I guess I'd like to know people's experience in hearing about programs like this. Is this the first time you're hearing about a program to promote public health? If you could, if you can, click on the raise your hand button. You know how to do that, or just raise your hands. 1, 2, 3 people. Okay, so not many, it seems. So this is kind of your first foray into public health programs. So that's really exciting that you were able to join us. Can you all tell me what, oh, there's a couple more who raised their hand. Thank you. Can you tell me, I'd like to hear from some people about the #1 misconception about people with disabilities and their health. Any takers on this?
Yes, Amber Woods, can you hear me?
Yes, we can hear you.
Perfect. Yes. Actually, I conducted with my group about that same question, so I kind of will be like a quick representative of that real quick. One of the things is the misconception is that they don't know what the white cane is. And then also they think that everyone has a caregiver who has a disability, you know, like if it's with the healthcare plan. So they would say something like, well, where's the person, you know, who's supposed to do your paperwork? And I'm like, some people don't have a caregiver, or they want to strive for more independence. So I think that's one of the biggest major component. And then also accessibility, like, you know, they say go to the website, but some people either don't have the skill sets, or sometimes we find out there is an inaccessibility to such websites that is to promote health or anything else. So that's my take.
Thank you, Amber. Anyone else about misconceptions about people with disabilities and their health?
I would love to have some feedback if anybody has a chance to take a look at our website, because I want to make it accessible. If it's lacking, I will make the changes to fix it. So thank you.
This is Siobhan. Can you hear me?
Yes.
I think some of the misconceptions are that people with disabilities, they just don't have the intelligence to care about their health or do anything, and people are just expecting someone else to take on that role. And if someone's a little more assertive about it, I think it's like a little bit of a shock to them.
Great.
Yeah, Tawanda here, or Wanda here. I'm new to the area, still within a year. So I think that was a very helpful site that and that I'll take a look at it during this time. But I think that another misconception is that maybe we don't totally understand our own health disparities and disabilities and illnesses, and that we are trying to reach out, but sometimes there's a number of blockers in our way, because it's always call this number, call that number, go to this website, go to that website, but it may not be as structured or to be independent sometimes.
Thank you for your feedback, Wanda.
Can I be heard?
Yes, you may, Lorna May.
Oh, hello. One misconception I see is that people with disabilities are often thought probably to be a little lazy. They are dependent, want and for lack of a better word, always wanting to depend on someone else to do things and not want to do it for themselves. So that's a big thing. And don't want to
Thank
be involved in their healthcare like they should.
Thank you, Lorna May. I'm taking notes as y'all speak. Anyone else for this question? Because I've got more. Okay. So what could be done to improve access to public health programming? Cheryl Grossman?
This is Cheryl. So I think a lot of us have spoken about it already, but the inaccessibility of websites or the dependence on websites alone, and not having easy access, but also the assistive technology. So many of our health fields are going to wearable devices and contraptions that we can more quote unquote independently manage our conditions at home and then report back in. If those technologies and those wearables are not made accessible, it doesn't do us any good. So blood pressure cuffs that are not able to be manipulated, even the talking blood glucose monitors for people with diabetes that's not covered by insurance. These things can only be as good as the forethought to make them accessible.
Great, thank you, Cheryl. Cheryl Gottlieb, I think your hand's up. Is that a new hand?
Yeah, that is a new hand. So I noticed in the presentation, some of the groups specified that they would only take you if you didn't have a cognitive impairment. And I mean, some people have age-related cognitive decline, but some people have, cognitive diagnoses, their whole life. And we really should be working on plain language materials so that everybody can participate. And also, even if you're doing an in-person class, if you, instead of taking notes, like on chart paper or whatever, if you took them in a Google Doc on a projector or something, then people who are using screen readers have the immediate access to the notes. Simple things like that people don't think of.
Thank you, Cheryl. Anyone else to discuss, what did I ask for? Access to public health programming. Go ahead.
Yeah, I think a lack of just asking, individuals may have the same type of a disabilities, but need different types of help. So I think you asked what can be done. I think just ask what is more convenient, or is that accommodation needed? For example, the website, when websites are put up, you're hoping, hey, I hope I'm able to get on, but simply asking someone who is visually impaired, or, how accessible the websites are. But I think asking questions to individuals is really important to find out.
Great, and we're heading up, it's after 3 now, but I have 2 more questions to ask. So if you would like to stay on, I would love to have you stay on to help us answer these questions. And if you have to go, we understand. The next question is, what partnerships does public health need to establish in order to reach out to the disability community? Anyone?
Partner with other
What was that
agencies.
question again?
Oh, I'm sorry, someone was talking.
Yes, what was that question again? And I want to also say something too. I was just on a thing back in September with people on the go. I don't know if I remember I sent you that info, but there was this woman named Tyree Brown that I recommend. And she was talking about, at age 20, when they talk about age and they talk about being she had to be in a nursing home at that age. And now she's doing arts. If you look up Tyree Brown, I think she has the arts design. Yeah.
Great. Thanks for sharing, Chioki. So my question was, what partnerships does public health need to establish in order to reach out to the disability community? Someone was talking. I don't know. Was that Lorna May?
It was, but now that I thought about it, I was just gonna say if we can just reach out, and that's why I stopped, because I said that's a silly response, but I'll say it anyway. If we reach out to those that are serving other, try and reach out to, everyone that serves or agencies that serve the aging or people with disabilities. I don't think we have, we could do better doing that, partner it out with those that we know serve the disability population.
Great. Wendy, did you have something to say?
I do. I feel like the outreach to have leaders lead programs. We know it's so important with where programs are offered and who the programs are offered by. We know that we can see it in retention in programs when there's a vested buy-in and a trust with in the community from the leader to the folks that they're leading to. It should be representative of the community that where we're leading and who we're leading it, who we're offering the programs to. So I think it is really going to be critical to have folks trained in programs that you want to see other individuals attend.
Great. Thank you, Wendy. Cheryl Grossman.
And then Amber.
Yeah.
Oh, okay.
Hi, this is Cheryl. Real quick, because I got to jump to another meeting, but I was going to say the best way to build up that trust is to have people with disabilities involved from the very beginning. So have us at the table, have us at least consulting, if not hired into the programs, so that the community sees people with disabilities as representatives of the programs.
Great. Thank you, Cheryl. Amber, and then we'll go to Lana and then Cheryl Gottlieb. I think that was the order.
Yes, I agree with wholeheartedly. Have us at the very beginning, like cradle to grave, if you will, in the cycle program of these programs. In fact, actually, that's what our chapter has done with the Family Department of Family Services here in Prince George's County. In fact, would love to share that model of evidence that we have produced, because I knew about the free programs, and my first question was, well, gee, have we even reached out to persons with disabilities community at all with these free programs? And the short answer was kind of like a no. And diabetes is actually an ADA covered disability. So, I was grateful that, and the rest, as they say, is history. And I'm so grateful of the progress that, and grateful that we have an evidence base of our own of exactly that's the type of partnership we need to start creating, is to talk to the disability leaders as well. And also maybe even commissioners of like disabilities, commissions that's throughout the state of Maryland. I also serve as a commissioner as well. And so those are the things that I think will be great, because that's the communications that we need to start having. So even seeking out, even if not maybe political, at least start with the commissions that exist throughout Maryland to let people know that these programs exist and that health can definitely be attained and individuals with disabilities can definitely self-manage healthcare.
Thank you, Amber. So Lana and then Cheryl.
Going on, okay?
All right. See you later, Chioki.
Will we have a meeting next week?
Yes. No,
Oh,
I don't know.
you don't know?
I don't. Is my
Just be on the lookout for an email, Chioki.
Okay. Thank you. Thank you, Heather. Sorry, Lana. Go ahead.
Hi, I just wanted to say I think it would be helpful. For instance, I am like just learning about a lot of these programs, and I have been disabled for about 6 years now. And I just think about how great it would have been to have known and found out toward the, onset of diagnosis. And I just think if there's some way that these programs can be told to people through providers, because when you're dealing with disabilities, you don't really always have time or energy or brain power to like look up these programs. Like the last thing on my mind is usually like trying to find something like this. Like I'm just in the bed, like trying to manage my medication and my symptoms. But if like at the onset, at diagnosis, or, say my rheumatologist, for instance, had been able to tell me about some of these programs as I'm coming into my, mandatory, or not mandatory, but, people have to go to the doctor. And, if we could find out that way, or through insurance, or even if hospitals could like pass along the information based on patients who have the relative disabilities, that would be extremely helpful.
Thank you. And I think as part of kind of Maryland's move towards the one payer model, or all payer, whatever they're calling it, that is going to be reality, that people are going to want to see people successful in the community, because they will be disincentivized, is that a word, to have people come back to the hospital. So hopefully that is the case. And I think these comments will help with that. Thank you. Total cost of care, Jennifer. Thank you. Siobhan, you had your hand up as well, but you just put something in the chat, so I can read that. For those who are blind vision or blind low vision, the Prodigy, Prodigy is for blind.
Do you want me to just go ahead and say
Yeah,
it?
go ahead.
Sorry about
And then
that.
we'll go to Cheryl.
Okay. No, I was just making a comment to, I believe it was Sarah, regarding the glucose machine for people who are blind or visually impaired. And if you speak with your primary care doctor and they work with the administrator of their department, and they always have a specialist who deals with Medicaid, Medicare, and if you let them know, hey, I'm a blind individual or dyslexic or low vision, I need this particular glucose monitor, the Prodigy, and they write a letter and they see the dire need for it, however they do their magic, your insurance, at least Medicare, Medicaid, will pay for it.
Great, thank you.
All right.
Thank you. Cheryl Gottlieb, it's on you.
Yeah, so I think historically, and I'm talking, more than 20 years ago, there was an incredible amount of stigma between the mental health community, the physical disability community, and the intellectual disability community. And I don't know a single disabled person that has one diagnosis. We're all living with multiple issues. And I don't think that that stigma really exists anymore, at least in my experience. But unfortunately, the silos that were set up in the 20th century, they still exist. And I also think that the stigma still exists between the aging community and the cross disability community. Older people in my life don't like to admit to being disabled. And when I call them that, they give me dirty looks, but they have, just as much or more difficulty navigating the community than I do, as a 36-year-old. They're totally disabled. So I don't know, what the answer is about, working on stigmas and silos, but I think that, between the IL community and people on the go and on our own and, all the, drop-in centers, we really need to work a lot closer than we do right now. I think it's a shame. because we do have a lot to share with each other. And most of the people that I've met, because I worked for an On Our Own, they don't know the SILs exist. The people that are going to People on the Go meetings, they don't all know that SILs exist or that On Our Owns exist. And it shouldn't be this way now. It's almost 2022. So I think we'd get a lot more notice out about things that were available if we were actually talking to each other, and we don't, in my experience.
Thank you, Cheryl. The last question is more for, service providers, whether you be a SIL staff or staff somewhere else. What resources would assist you in engaging or referring your consumers to public health programming? Not all at once.
Hi, I'll chip in on this one. Consistency. As someone had mentioned earlier, there's, so many different community organizations and, hospital centers, care centers. There's, a ton of resources, but it's all kind of dispersed out and not very connected. So if there was, as Cheryl had mentioned, better communication between healthcare providers, community centers, community organizations, so that information could be more streamlined, that would be like an incredible help. Because as Lana had also mentioned, on the onset of my disability, I had no idea about SILs. I had no idea about some of these community organizations. And that was coming out of the hospital with my diagnosis. I had, no idea about any of these community resources, on the onset of my disability.
Thank you, Nikki. I appreciate that. Any others people want to talk about SIL staff or otherwise on how what would be helpful to engage or refer people you work with to these public health programs?
I think it would be helpful if physicians actually wrote a script for them.
Okay. Anyone else?
If we could have the PowerPoint, we could definitely distribute it to everybody if that would be okay.
I'll be sending that to Katie.
Okay,
sure.
Fantastic.
Mhm.
And I can make sure our SIL staff who aren't able to be on the call today have a copy of it. So
yeah, and what
one small step anyway to getting the word out.
I think what I'll do is I'll also do a Survey Monkey with these questions that we can send out to everyone in case people didn't have the opportunity, if that's okay with you, Heather, because you're going to be sending it out. Didn't have the opportunity to see Wendy's presentation and provide feedback, that we give an additional opportunity to do that. And I guess for those of you who are still on the call, stay tuned. This is the kind of the beginning of many of our journeys into connecting people to public health programs. The SILs in Maryland are still very new at this. We're just realizing in the past couple of years that these things exist, and that people with disabilities are able and encouraged to attend. So, stay tuned. If you have any other comments or suggestions on any of the questions I asked, I'm going to put my email in the chat and you can feel free to email me. But other than that, I think unless anyone else has something to say.
I have one more thing.
Okay,
Again,
Wendy.
I think social media is playing a much bigger role. So if you like us on the Facebook or whatever, we're going to expand to Instagram and Twitter and all that sort of stuff. But we'll be pushing classes across the state, that way, and we can, you can share that within your team organization.
Great. Yeah, and I know Sarah and I both use the same social media person, so anything you send to me gets to Sarah too. So definitely we'll connect via social media. And all of you, I encourage you to also do that, and also connect with your local SIL or all the SILs. It's up to you. There's a lot of good stuff going on. So I think that wraps up our programming today, unless anyone has any announcement they want to make. I guess, you know, you just wait long enough and everyone drops off the call. No announcements. Perfect.
Actually, I think Stephanie had one.
Oh,
for the
okay.
Image Center.
Go ahead, Stephanie.
And I'm muted. Okay. I am hosting a fundraiser for the Image Center. Touchstone Crystal is a jewelry product that we have kind of shared around at the Image Center, and we've had all hosted different parties. And I have just started recently selling it, and we are going to do a 20% of all sales go to the Image Center of Maryland. So I'm going to post, let's see if it'll work, the link to the party. I'm going to try to get something on our Facebook page. If anybody wants to order anything, anything that is ordered by the 10th will be delivered in time for Christmas. They say the 15th, but I'm going to say that we're going to have everything open though till through the end of December so that we can make as much money for the Image Center as possible. Thank you very much.
Thank you, Stephanie. Okay, if there's no one else, I think it's time to call it a
I've got
day.
one real quick.
Oh, I'm sorry.
I just wanted to mention that People on the Go is putting on some Project STIR trainings. It was originally a 16-hour training. So there's different modules on different days. It's not all on the same day. So the first two that we're running for the winter session are December 10th and the 13th. I don't have the times off the top of my head. I think the 10th is at 10 a.m. and the 13th is at 3 in the afternoon, but it's different material. I think Independence Now turned it into a Facebook event. There's also an email that went out. The training is free, and it's an introduction to self-advocacy concepts is basically what it is.
Great.
This
Thank
is
you, Cheryl.
Amber.
Yes.
Yes, I just want to say once again, thank you. I cannot let everyone leave without me saying first, thank you for allowing me to be on here today. This was a wonderful presentation. And like I always say to my members, and I will also extend this to you guys as well, and ladies and gentlemen, just make sure I include everyone, that we're better together. We really are. And I love the idea of just continuing to keep that communication open. And I will definitely be sharing most of the videos. I got a chance to look at some of the things that your organization does. So I'll definitely love the videos and the playbacks that I will definitely share with my group as well, and continue this conversation as well. This is definitely a beginning, not the end. It's definitely just the tip of the iceberg, as they say. So thank you once again. We also have a holiday party. It's an in-person event for the National Harbor chapter. It's at Three Brothers in Bladensburg, Maryland. So if you're interested, just call me. My name is, once again, Amber Woods, president of the National Harbor chapter. My number is 301-978-6686. So if you feel comfortable enough to go, if not, you know, you'll celebrate with us in spirit. And, you know, once again, just call me at 301-978-6686. And thank you once again for this lovely presentation. This was really great.
All right. I think that's it. Everyone, I hope you have a good rest of your week, and look out for an email from the Image Center about upcoming presentations for IHIM. Thank you.
Thanks.